Hello everybody, it's Dr. Galvin with today's coronavirus update. As you know, I do these updates every day. I've been doing them since this crisis first started. In case you don't know who I am, my name is Dr. Jeffrey Galvin. I'm a board-certified emergency medicine and obesity medicine physician. I work in the emergency department. I've had about 25 years experience in the emergency department, and I also founded and am the medical director for Vitality Medical Wellness Institute here in Charlotte, which is a functional medicine clinic that focuses on dealing with underlying causes of disease and optimizing human performance. As usual with these videos, we start with the numbers, and these numbers are from Johns Hopkins. 3.9 million cases worldwide, 274,000 deaths, 1.3 million recoveries though worldwide. Here in the US, 1.28 million cases, 77,000 deaths, 198,000 recoveries. Now, if anybody's watched my last couple of videos about the Plandemic movie, especially if you've read through the comments on YouTube, you can realize that civil discourse seems to be dead in this country. God forbid anybody say anything against anybody's held beliefs, regardless of proof, regardless of evidence. You're going to get some very venomous replies. And so people are going to be, I'm sure, are going to tell me that Johns Hopkins is owned by Bill Gates, it's implanting microchips, doing something, but Johns Hopkins is a pretty reliable institution. But if you don't believe that, look at the CDC excess death counts. Now again, the CDC conspiracy, can't trust anything. Well, you know, we've got to have some information sources that we've got to rely on. And to just cast aside any information source that doesn't agree with your point of view as being fake is ridiculous. So the CDC tracks excess deaths, meaning that we expect a certain number of deaths per year at certain times of year. And they've got numbers going back a long time, but on their site, it goes back maybe 4 or 5 years. If those deaths exceed a certain point, and I don't know how many standard deviations, probably 2 above the mean, then that's considered an excess death. And if you look back over time, you can see that around 2017, 2018, there was a little blip of excessive deaths in the winter that was associated with a particularly bad flu season that we had. But if you look at the data now, you can see that there's a very significant increase in excess deaths starting around March 28th. The numbers are about 4.8% above normal on March 28th, and then week after week it went up to 22.5%, 36.8%, and the week of April 11th was 28.8%, and the data stops there because their data lags, because they're gathering final death certificate results, lags by about 1 to 8 weeks. So those death certificates, some of them are filled out in paper, they've got to be finalized and everything else. So regardless of whether you believe any of these numbers, something is killing a lot of extra Americans in this country. Now, civil discourse, what that means is that people should be able to express ideas without getting lambasted, and they should be able to open themselves up for reasonable criticism, and that's what we're trying to do. Now, today we're not going to talk about Plandemic, we're not going to talk about any of the crazies on YouTube. What we're going to talk about is reopening, because here in North Carolina, today is the day of phase 1. At 5 p.m. today, we opened up to phase 1 of reopening. Now, what does that mean? That means that now most retail operations can open again, so most stores, but spas, restaurants, or spas, gyms, hair salons, things like that where there's really close proximity are still not able to open. And restaurants still can't have seating inside, but they can do takeout. And there's a few other restrictions. Now, I've been saying for weeks now that we need to reopen because locking people away is doing more harm than good. It just gives people time to we're seeing increases in domestic abuse, in child abuse, in substance abuse, and plus poverty by itself is a huge risk for health. And if you take away people's livelihood, they're going to enter poverty, and we're going to have really big problems. Now, that being said, is this the right time to open? There's a lot of arguments to be said that it's not, because those numbers are probably really not leveling off in many places. Now, in some states they are, and so we're going to have to monitor. And what we may well see are very big spikes from doing this. However, we do need to do it. And I've talked about the Swedish model where we want to let people who are low risk, who's at low risk? People who are really less than 45 with no medical problems. Your risk of dying of this virus is minuscule. It's the same as getting killed in a car wreck in a year. If you're less than 65, it's only a smidge higher than that. Where the real risk comes in is if you've got these chronic medical problems that we've talked about time and time again, and if you're above 65, in particular above 70, risks go very high. So you can have, a 0.02% risk if you are an 18-year-old college student, and your grandmother could have an 80% risk. And so we obviously don't want to let the vulnerable people get exposed. Now, I've had people message me that it's not fair. I have a chronic medical problem and you're telling me I should stay home. Yeah, I am. And why am I telling you that? Not because I'm trying to be unfair, but this virus isn't fair. And the fact of the matter is that you're at higher risk and you're taking a big risk, much bigger than somebody who doesn't have that risk. And so we have to look at things and we've got to make balances. And yes, I think that if you're at high risk, you need to stay home. I do. I don't want those people to get sick and die. At the same time, I also want people to be able to go back to work and to support their families and everything else. So it's a balancing act. It's sort of, kind of despicable math, lives versus livelihood. But I think there's a middle path where we can protect the vulnerable and let the rest of the people who are not as vulnerable get back to work. Are we still going to have deaths in that less vulnerable population? We are. It's unavoidable. Now remember, what did we do all this lockdown for? It was to flatten the curve. Flattening the curve was never designed to save lives. I think you need to understand that. It was designed to prevent the healthcare system from getting overwhelmed and then the whole system falling apart, and then everybody's in huge trouble. We've done a pretty good job of that, and our hospitals are much more prepared than they were a month or two ago. And so now I think that in terms of the medical system, we have the capacity, and not only that, but now we have experience dealing with this virus, that I think that if we do have surges related to reopening, we're going to be able to manage those much better than we were in the past. Now, that doesn't mean that we may not need to lock back down if we get a big recurrence, maybe from reopening, perhaps in the fall, when we think that there may be a second wave of this. But I think we're much better able to handle it, and so I think it's reasonable to do it. So I want to tell you, my friend Brent Holbrook sent me a great link. Thank you, Brent. It was awesome. From this PhD, Dr. Aaron Bromage, who's a biologist at University of Massachusetts, Dartmouth, who wrote this really cool little sort of summary of viral replication, viral load, infectivity, and how to protect yourself from getting infected. And I thought it was really awesome. And so I'm going to all this data comes from her. She's got great references. If you don't believe me, conspiracy folks, then go look it up. Like I said, don't believe anything I say. Do your own research. Now, infection to this virus is related to two things: exposure to the virus plus time. So while this is a new virus, we're not 100% sure. We think it probably takes about 1,000 virus particles for us to get infected, okay? Now, we can get those all at once by being in a healthcare setting and being in a room with aerosolized virus that's really high density and not wearing a mask, or someone coughing or sneezing directly in your face. But we can also kind of have a cumulative load, meaning that maybe somebody is in a room talking to us and we're getting small boluses of virus over time. We reach that 1,000. Or maybe we've touched an infected surface and we keep touching our face a few times. So there are different ways. So if I'm getting 20 virus particles at a time versus getting 100 versus 1,000, I need to get 1,000. And once I do that, there's a potential for me to get sick. So what does that really mean? What happens when we cough, for example? Well, when you cough, you expel about 3,000 respiratory droplets. If you sneeze, you expel about 40,000. In that cough, how many virus particles are probably in those 200 or 3,000 droplets? Probably about 200 million particles. So you only need 1,000. So you can imagine a cough or a sneeze is a very dangerous thing. So if you have those symptoms, please stay home. Don't go out. That's one of the things we talked about with masks. Try to keep that stuff contained. Now, when you're breathing, you're still releasing viruses, but it's at a really low rate, and those viruses are going to tend to fall to the ground. And you're going to probably release maybe 50 particles at a time. Who knows? And if you're in the room with somebody who's just breathing, who's infected, it would probably take about 50 minutes for you to get infected. So if you're just in a room with somebody else who's got the virus that's fairly close and you're just sort of sharing the air, it would need to be almost an hour before you could get infected. Now, if you start speaking, that number goes up by a factor of 10, and then you really only need about 5 minutes to get an exposure. So if you're talking to somebody, close talking or whatever, it's a risk. So again, another reason to potentially wear a mask while you're in close proximity to someone so you don't spray those viruses if you happen to have it. Now, We know that about 44% of cases are being spread by people who are asymptomatic when they're spreading it. And that means that we know there are people that get the virus, they shed the virus, and they never develop symptoms. And there are other people that have maybe 5 days where they don't have any symptoms, and then they get sick. And those folks that are having those periods of time, the viral load kind of increases every day. So that maybe day 1, it's a little bit of virus, more on day 2, and then day 3, 4, 5, it keeps going up and up and up, and that's probably when they're most infectious. And then they're really infectious when they get sick. So that's important to understand, and that's some things that you can use when you're doing your own sort of strategic, going out and shopping and things like that. And so the other interesting thing was this idea of sort of super spreader events. And so Dr. Bromwich did a great job of sort of gathering up a bunch of papers that looked at case studies and other events that resulted in virus spread. And they looked at a few things. And so what are these big super spreader events? Well, one of them is meat packing plants, meat processing plants. There's 115 outbreaks currently in the U.S. Now, why is it? Because these people are working in close proximity. They're talking. They're yelling and screaming because it's loud, industrial, and they're arm to arm. And so, the more yelling, the more you speak, the more virus particles. So it's a high risk environment, and that is why we're seeing those cases in meatpacking plants. Weddings, birthdays, funerals have been linked. Business meetings, like the Biogen conference that had a lot of cases. Restaurants, so restaurant spread is an issue. And also workplace. So there was a case report of a call center, I believe it was in Hong Kong, and I want to get my numbers right. A call center, 216 employees, 94 got sick from one person who was sick. And it was interesting, the office was divided in sort of 2 halves, and the majority of the cases were on the side surrounding the guy who was sick and didn't have any symptoms. He had actually come from Wuhan. Another one was a choir practice in Washington State. You may have read about this. They had a choir practice. 45 out of 60 people got sick. 2 of them died. Again, choir, singing, lots of expression, so it only took one person in that case. Indoor sports, there was a case report in Canada of a curling event. 24 people sick out of 72. Again, a lot of sort of yelling and close proximity and things like that. So what are the things we need to worry about? Well, it looks like indoors, close contact, lots of speaking, singing, yelling. So those are things. Now, interesting, another study showed that the risk of getting it while shopping was actually really low. So going to the store, taking reasonable precautions, maybe a 3 to 5% risk, much, much higher if you're inside. Outdoor areas, really, really low transmission outdoors. I think 0.3% was what Dr. Bromwich quoted. And so that's interesting information. It's important because as our states open up, and I know a lot of people are watching this are not North Carolina, but as your individual state opens up, those are some things you can do to sort of avoid putting yourself in a position where you might get infected. Now, as people know, I'm a big fitness person, and unfortunately, that close contact, yelling, breathing hard, certainly, puts a gym setting at risk, which I hate. But the gym I go to is starting to do outdoor classes, which I think is a really good thing. The summer's coming on, and so maybe more gyms will need to think about moving classes in open spaces and outdoors, and that's going to be a challenge going forward. I'm going to stop it there. I am a little bit exhausted from the last couple days. My faith in humanity was shaken after the first Plandemic video and all the nasty comments on there. But it was resurrected because I've literally received hundreds of supported messages on Facebook, on YouTube, private message through my website, the Vitality website, texted, called, physicians, nurses, friends, college friends, high school friends, people that I haven't talked to for years and years and years have reached out. And for that, I'm grateful. It really kind of regenerated my respect for humanity. So thank you very much. I will talk to you again tomorrow. As usual, wash your hands. That's the other way to keep safe. Protect yourself, protect those around you, protect your families. If you like this, please subscribe to our YouTube channel. Click the bell so you'll get updates. Like us on Facebook and follow us on Facebook. And I'll be back tomorrow. See ya.